Diseases-Samuel Sane at Kim's Hospital, Hyderabad, and I have a friend, a good doctor, Dr. Raghu Kishore, a cardiologist. Doctor,
Yeah.
I want you to say hi to this.
Yeah.
Kenyans.
Yeah. Hi, Samuel, and hi, all Kenyan people. So, thanks for your kind introduction.
Welcome.
I'm Dr. Raghu Kishore Galla. So, I'm a consultant interventional cardiologist working here at Kim's Hospital, Minister Road, Secunderabad, in India. Yeah, India.
A good city.
Yeah, good city.
Very populated.
Yeah. Densely populated too.
And full of biryani.
Biryani. Yeah.
Biryani.
Have you enjoyed it?
Yeah.
Very nice. Very
Yes,
nice.
doctor. Now, what is your specialty?
I'm a cardiologist, so in routine terms, it is heart doctor.
Heart doctor.
Yeah.
What does a heart doctor do to a patient?
Yeah. So heart is the most important organ in the body. So which start functioning from the birth to the death. Every minute, every second, it should beat
Yes.
to maintain blood supply to all the vital organs like brain, kidneys, liver, and muscles. So once your heart stops, you are no more. So that is the importance of the heart. And day by day, the diseases of the heart are increasing. So you are getting so many heart attacks. So heart is the most important muscle of the body. So it will pump every minute. So for every beat, it will pump around 70 ml of blood. So we will have around 5 to 5.0 liters of the blood. It will beat for 70 times, 70 to 85 times a minute per minute. So it will pump total 5 liters of the blood in 1 minute throughout the body. So it will take all the good oxygenated blood to all the organs of the body so that they will function in a proper manner. But heart is also supplied by blood vessels which are 2 to 3 mm in size. So it is called coronary. They are called coronary arteries. So coronary arteries. So if you get any blocks in that, decreasing the blood supply or cessation of the blood supply to the heart will lead to dysfunction of the heart. So this is called heart attack. Okay, the patient will get severe chest pain when they block. So the vessels supplying the heart is called coronary arteries. They are 3 in number. Left side there are 2 vessels, LAD and LCX, and right side 1 vessel. It is called right coronary artery. So if you get any blocks due to fat or calcium due to aging, so if they deposit calcific deposits on the heart, so they will so compromise the blood supply to the heart, so which may lead to sudden heart attack. So the patient will get severe chest pain, shortness of breath, palpitations, giddiness, sometimes loss of consciousness. Sometimes sudden loss of blood supply can lead to heart to beat irregularly. It is called arrhythmia. So arrhythmia can lead to patient sudden collapse and death. So that is the importance of the heart attack. So you have to be aware of having what symptoms of the heart disease, and you should be very careful to maintain the heart health, because if any heart disease, if it is very sudden and very serious, and if you don't respond within a golden hour, that is called less than 4 to 6 hours when a heart attack comes, so it may lead to serious damage to the heart, pump failure, eventually sometimes death.
What is the difference between coronary artery and aorta?
So actually the total blood supply from the heart, so there is a left ventricle which pumps the blood. This oxygenated blood comes from the lungs to the left ventricle, and it will be going through the aorta. Aorta is the biggest artery of the body. Okay, so it will have so many branches. It will supply brain, carotid arteries, brachiocephalic arteries to the limbs, and it will supply coming down to the descending aorta. It will supply to the mesentery and intestines, and it will leads to renal arteries. Coming down, it will supply to the lower limbs like iliac arteries, femoral artery, and popliteal artery. So this is the main artery of the body is called aorta, and coronary arteries are the branches, or smallest branches of the heart. So they also come from the aorta.
There is aorta, there is coronary artery,
Yeah.
and ventricle.
Ventricle. So the aorta comes from the ventricle, and the ventricle is supplied by the coronary arteries, which in turn the branches of aorta. So the coronary arteries also are the branches of the aorta.
So the only function of the heart is pumping only.
Yes, so it has to, there is no rest for the heart. If heart takes rest, you are out.
Where does it get the energy from?
Yeah.
Where
So,
does it get the energy?
so the heart muscle as actually, it will get energy from the, so the musculature, there is ATP. So ATP is continuously produced to get the contraction. So calcium and ATP pump. So it will be working, so relentless working, so which lead to the, so actually continuous pumping of the heart throughout the life. Okay. Yeah. So it will energy. It will get the blood supply from the coronary arteries and energy from the blood and calcium in the blood as well as in the ATP. So these pump in the muscle will lead to continuous contraction of the heart muscle throughout the life.
Yes.
Yeah.
Wow, that is great.
Yeah.
So only we need to eat balanced diet so that we can maintain the.
Yeah, I will tell very, very important, because nowadays more and more young people are getting heart attacks. In our practice, in a week we are seeing at least 5 to 6 people per week in my practice are less than 40 years of age, because there are few risk factors for heart disease. There are two types of risk factors. One is modifiable risk factors, second is non-modifiable risk factors. Non-modifiable risk factors are our male sex. So males are more prone for heart attack than females. And once menopause is done, females are equally prone to get heart attack as males. After menopause. Until they get the cycles, they are protected by the estrogen from getting heart attack. That is
so
a
the menstrual period, it's an advantage.
advantage.
To women.
Yes, advantage to
Can
women.
you explain to them? Tell them.
Yeah. So women are at the advantage of getting less heart disease, because estrogen prevents heart attack to come. So once their estrogen phase is gone, they get their menopause. After that, they are equally prone of getting heart attack. So until then, most of the females are protected from the heart. That is first point. Second is age. As you age more, you are more prone to get heart attack. So in elderly, because it's a normal phenomenon. So blockage of the arteries is a normal aging phenomena. So when you age, there will be formation of the blockages due to cholesterol as well as calcium. So they will deposit in the arteries. If you can do angiogram in a person who is 70 years, 100 people, at least 70 people will have blocks.
Yes.
So, but it doesn't mean that everybody will get heart attack. So the total blockage of the artery will only lead to the heart attack, and nobody knows who will get heart attack. That's why everybody survives. Everybody doesn't know that they are having blocks, but they will survive. So that's a boon. That is second point. Third, a non-modifiable risk factor is a family history. So if any of your family member is having heart attack, like your brother, your mother, your father, so you are at high risk of getting heart attack. So family history is a most important factor. So that's why if anybody of your family has suffered from heart disease or heart attack, then you have to be more careful, and more screening is needed, and you have to be more follow-up with a regular doctor, and you should be more aware of heart attack symptoms and all. So these three are genetics, family history, and male sex, and age. They are not on our hands. Yes. So those are called, that's non-modifiable. Coming to the modifiable risk factors, that means risk factors which are in our hand. Okay, those are smoking.
Yes.
So smoking is the most important risk factors of heart attack in young.
So smoking is dangerous.
Smoking is dangerous. Apart from getting cancer and lung disease, it is the most common
there
cause.
is smoking of cigarettes and other items like
e-cigarettes and all. So they are equally.
Even e-cigarette is not good.
Yeah. Even they are also very much dangerous. So don't smoke. So it will lead to increase in the clotting tendency of your blood, which can clog your arteries. So if I see, if any person less than 45 years of the age comes with a heart attack, more than 90% of smokers.
Yeah.
Okay, smoking is the number one killer. So apart from getting cancer and lung disease, heart attack is the most important this risk factor for the smoking. Risk factor. So the smoking is the risk factor for heart disease. And second thing, hypertension, high BP, high blood pressure, which is uncontrolled blood pressure, so which can lead to high pressure in the heart, which lead to the heart to enlarge, and the demand of the oxygen will increase, so heart attack may occur. And the third one is diabetes. So diabetes is the most common cause of the heart disease worldwide. So if you have uncontrolled diabetes, automatically that bad cholesterol will go and deposit in the arteries, which can clog the arteries, leading to the coronary artery disease or heart attack. So hypertension, diabetes, smoking, and obesity and metabolic syndromes. It's an emerging risk factor. So more and more people, because of the sedentary lifestyle, so more people are software engineers sitting morning to evening in front of the desktop, and after going home, you are watching TV and not doing anything. Nothing, and screen time. Before going to sleep, we will see screen for 1 to 2 hours.
Yeah.
So the more the screen time, the more obese you become, and more the basal metabolic index (BMI). Yes. So that is body mass index. Yes. So BMI is more, and you are prone for getting metabolic syndrome like hypertension, diabetes, obesity, hypothyroidism, obstructive sleep apnea. So these are all called metabolic syndrome X. So these are all the risk factors for the heart disease. Yes. Recently, changing in the lifestyle like stress, targets, and more lifestyle. So my lifestyle related. So like more stress, less sleep, changing in the shifts, even air pollution.
Yes.
So these are all contemplated to be the recent risk factors for heart disease.
Wow. Yeah. Let me ask you, doctor. You said about hypertension.
Yeah.
Can it be treated?
Yeah, hypertension is treatable.
How can it be cured?
Yeah, two things. So hypertension is called a silent killer because it won't cause you pain. The patient will go to doctor if you have some symptom. So even I have seen so many patients. If a routine checkup, they will have 200 BP, but they are not aware of that they are having high BP. So that's why it is called silent killer. So when the BP is there, so you should check by yourself.
Yes.
And very few people will get the symptoms like headache or something, giddiness, or so lightheadedness like that. So or chest pain, but more than 50 to 70% are asymptomatic. So when you check the BP normally or regularly, so the BP will be more 180, 200. And second thing, hypertension is idiopathic. There is no cause. So 90% of the hypertension is called primary hypertension, which is genetically regulated. Okay, so that is called primary hypertension. Only few less than 10% is secondary hypertension, maybe due to other causes like renal artery disease, kidney disease, or endocrine disease. So the other side of these things is secondary hypertension, which are very, very low. So once you are diagnosed as hypertensive, you will remain hypertensive for lifelong. So you can control the BP, but you cannot cure the BP. So you have to take the BP tablet for lifelong. But I have seen some patients which have controlled their BP with lifestyle modification, like decreased salt intake and increased physical activity.
So salt is dangerous.
Salt is dangerous. So WHO recommends less than 2.5 grams salt per day.
So you should check on that.
Yes. So you have to decrease your salt intake, and you have to do a rigorous physical activity at least 40 minutes a day, like jogging and walking and doing gym or yoga, and you have also to control your emotions, and you have to meditate or do yoga, and so you have to leave your all negative emotions, so that which will lead to hypertension.
I've heard some people saying that I should not take uncooked salt. Is there any relationship?
No, there is no relationship between cooked.
Salt and sugar.
Any salt is dangerous, either cooked or uncooked. So better to don't eat too much of pickles and papads or stored salted foods, like even meat which is stored, so they will add more salt for longevity or shelf life.
In our culture there, we have, we call it nyama choma.
Yeah.
This is roasted meat.
Roasted meat. So it will be there in the shelf for 1 or 2 years. That's why they will add more salt, so that we can eat anytime. Here we use pickles, red pickles.
Yes.
So in the mangoes and all, they made a pickle. So they will add more and more salt for longer. So it has to stay for 1 year.
Yeah.
So that's why they will add more salt, which is very, very dangerous to the heart, which lead to hypertension.
Okay, Doctor, I've heard of several cases of ASD, BSD. What are these?
There are, in simple words, I'll tell you. So heart has 4 chambers.
Yes.
Okay. So just I will take an example as a house. So heart is a 2-stored house.
Yes.
Okay. Down there are 2 chambers and up there are 2 chambers.
Chambers.
Okay. So 4-room house.
Four
Okay.
houses.
In house you should have what you should have. You should have some plumbing. So some water supply.
Yes.
That is coronary arteries, and it is example of blood supply. And the third thing, you should have some current. Okay.
Yes.
That current is electrical system.
Yes.
So electrical system means, so the heart will have some separate conduction system where our beat starts, and the beat will so propagated through a specialized system in the heart apart from muscle, and it will propagate it to all the chambers of the heart so that they will contract synchronously. So that is called conduction system of the heart. Any problems in that system will cause short circuit. That's why suddenly heart will beat with 200. That is called arrhythmia. So yeah, the electrician of the heart is called electrophysiologist. That is that the plumber of the heart is called interventional cardiologist. Okay, and heart will have some structural problems, like you will have some cracks in the wall or something.
Yeah.
So there is abnormal window between the upper chambers of the heart is called ASD, atrial septal defect.
Upper chamber.
Upper chamber. Lower chamber is called ventricular septal defect. So the 2 upper chambers are called atria, and 2 lower chambers are called ventricles. The left-sided heart will have oxygenated blood, so which is pure blood, and right-sided heart will receive deoxygenated blood from all the limbs and lower body, and it will supply to the lung. Lung will take oxygen from the air and it will purify the heart.
Yes.
And from there it will come to the atria, left atrium, and to the left ventricle. Purified blood will come to left ventricle, and through the aorta, as you said, it will supply to all the vital organs of the body. So this is the mechanism of the heart. So if there is any abnormal connection between either atria or ventricles, like upper chambers or lower chambers, there will be abnormal mixing of the oxygenated and deoxygenated blood, which may lead to, so that if deoxygenated blood comes into the oxygenated blood, so deoxygenated blood is blue color and oxygenated blood is bright red. So if blue blood, if due to abnormal connection, so they are very, very important during fetal circulation. They are very, very important during fetal circulation. But once the baby borns, they have to be closed by themselves. So it's a natural mechanism. Once the lung expands, those defects has to be closed. But in few patients, few people, they are not closed. That's why they remain patent. So they are called atrial septal defect and ventricular septal defect. They will cause this blue color oxygenated blood to come into red blood, and which is inadvertently supplied to the organs, which will lead to the blue baby. So it is called blue baby syndrome. So blue baby. So if these congenital heart defects will lead to the supply of the deoxygenated or blue blood to the organs, which lead to the shortness of breath and other symptoms.
Yes.
So there are advanced techniques. So the science has. So usually they used to do open heart surgeries before. Now most of the 90% of these ASD and VSDs are tackled percutaneously. So we will
What
keep.
is this, doctor?
Yeah, this is called percutaneous closure by the device. If you have ASD, so it can be closed from the thigh.
From the thigh.
Yeah, from the thigh with a small sheath.
So you don't need an open heart
No
surgery?
open. 90% of the congenital heart disease we are just treating with
I heard
percutaneous.
of some children having holes in the heart.
Yeah,
Is the same problem?
same holes in the heart. 90% of the holes in the heart can be treated percutaneously because there are so many advanced devices that can be negotiated through a small pipe, or it is called sheath.
Just like endoscopy.
Endoscopy. So we will go from the femoral artery and you go femoral vein, you go into the left atrium and you put a button there. You will release a button. It will be like a butterfly. So it will hold the defect like this, so that it is closed permanently. So it's wonderful. We can do it in half an hour to 1 hour.
Half an hour.
Yeah, half an hour. Half an hour is
A problem that can kill someone.
Yeah, a problem.
And
That is the beauty of cardiology. The cardiology is the patient will not have symptoms before. The onset of the symptoms are sudden and severe. The patient will have severe chest pain, shortness of breath, and dangerous. So heart disease is very dangerous. If you don't treat in time, they may kill the patient. And treatment is very, very advanced and very simple. If you can do a angioplasty I will let you know what is angioplasty. And if you do a device closure to the hole, that is cured and the patient will be asymptomatic for life. That is the beauty of cardiology.
Let me ask you, doctor. I have heard of echo, 2D echo, and angiogram. What are these?
So actually 2D echo is echo is the image reflection. Echo means, what is the literal meaning of echo? Echo is an image. Image reflection is called echo. So that if it is two-dimensional, it is called 2D echo. So we have now 3D echo and 4D echo also in our hospital.
Yeah,
Advanced. Yeah. So that machine costs around 1.5 crore rupees. So we have that echo machine, which will give all the 4 dimensions of the heart. So it is simple. So echo is an ultrasound of the heart. So it runs on the principles of ultrasound. So the probe will send some sound waves to the heart. So and it will touch the heart. It will reflect it as image on the screen. So that is, and the blood supply in the vessels is also can be known. So that is called Doppler. So the two principles, one is ultrasound, sound waves, second is Doppler. These two principles will give you the structural and hemodynamic consequences of the heart. So components of the heart. So that's a bedside procedure. It can be done very easily and non-invasive, non-painful. It's like ultrasound scan of the heart. So it will give almost 90% of the basic information of the heart. The only information we can't get is how blocks inside the vessels.
You can see.
Yeah, that's why we have to go and do angiogram. Angiogram is to find out blocks in the vessels, that is coronary arteries that supply the blood, that supply the heart. Okay, so we will go from a small artery from here. So there is no pain, no surgical scar or something, just a small puncture. We'll go, we'll put a wire here in the heart, and one pipe will be advanced to that wire, and you will hook the coronary arteries, and we'll give you a dye. It is a dye, so that is radio opaque dye, and we will see in the X-ray. So continuous X-ray is called as fluoroscopy, and the total equipment is called as cath lab. So we will do, so we won't do in surgical operation theater. So we'll do in cath lab. So we'll keep the patient there, and we'll inject some dye into the vessel supplying the heart, which will show you the blocks. So if any blocks is there, so angiogram is only diagnostic. So it will just find out whether the blocks are present or not, but it won't cure it. Angioplasty is the procedure that cures the block. That means, that means. So once you do the angiogram, if you have a 90% block, we'll call the attender, show the block. So here is a block, we have to clear it. If 1 or 2 blocks are there, so we can clear it with the stent. So then what we do, we cross the block with the wire, and on the wire we will advance a small balloon, and we will keep the balloon at the block, and we will inflate the balloon, so that it will expand the block, expand the block.
With a stent?
No, first balloon. It is called balloon angioplasty. But balloon, sometimes the block may recoil once you remove the balloon. That's why to keep it open, so we need a more radial stent. That's why we keep a stent. Stent is nothing but it's a cobalt chromium mesh. It's like a mesh. Cobalt chromium. So now
it does not rust.
It won't rust. That's first point. No iron and all.
It's like titanium.
Yeah, titanium. So and now to prevent blood to clot on that, so we are coating with the drug, paclitaxel or sirolimus or zotolimus. So they are anticoagulant drug. So they will be coated on the stent. It is called drug-eluting stent. So we used to have bare metal stent. Only metal stents were available 20 years back. Now every stent is a drug-eluting stent. That means it will release the drug for a few months to years, so that make sure that it is patent. Block won't occur. Okay. So we do balloon angioplasty. We will remove that balloon, and we will negotiate stent on the wire, and we will expand the stent there, so that the block is cleared.
Removable?
Not removable. So lifetime. Once you keep the stent, it is not removable. Sometimes we may remove during surgery, during open heart surgery. So if 1 or 2 blocks are there, we will keep stents. If there are 3 blocks and multiple blocks, we will send the patient to the open heart surgery. That is called CABG, coronary artery bypass grafting. That means bypass surgery. So they won't touch the block. They will remove vessels from this thing, and from breast, and they will connect after the block. That is called bypass. So keeping a bypass road for a, so you will have bypass road to bypass the main town. Like that, they won't touch the block. So, but they will take some vessels from other body like radial artery, saphenous vein, and they will connect from the aorta to the after the block. That is open heart. That is called coronary artery disease. That is coronary artery bypass grafting, CABG. Okay. So that is open heart. If the patient is having multiple blocks, we will send the patient to the open heart surgery. And sometimes chronic rheumatic heart disease. So everybody in usual terms, the blocks in the coronaries they will call as valves, 3 valves blocked, 4 valves blocked. They are not really valves. Valves are between the chambers. There are 4 valves: mitral valve, tricuspid valve, pulmonary valve, aortic valve. They also be diseased, especially in third world countries like Kenya. Chronic rheumatic heart disease. So infection to the valves will lead to the closure of the valve. So again, it can be tackled with 2 things: balloon mitral valvotomy. So we will put a balloon and we will open the valve like this. Sometimes if it is not very much calcified, already damaged, we will do open heart surgery and replace the valve with the steel new valve. That is also a separate material, titanium and cobalt chromium material valve. So it will work for 30 to 40 years, and we have to take lifelong blood thinner to prevent blood clotting or dysfunction of the valve.
Wow, that is great.
Yeah.
Doctor, which are the common heart diseases?
So there are different types of the heart disease. The most common is heart attack, coronary artery disease. It's called coronary artery disease or atherosclerosis, so occurrence of the blocks. Second is valvular heart disease, as I told. So either closure of the valve or leakage of the valve. So closure of the valve is called stenosis, and leakage of the valve is called as regurgitation. So either of these can lead to the volume or pressure overload in the heart, which may lead to cardiac dysfunction. So we can treat them percutaneously by balloon angioplasty, balloon valvotomy, or sometimes we can treat with the open heart surgery, valve replacement. The third one is congenital heart disease. As you said, holes in the heart. Holes in the heart, there are 2 types of holes. Simple holes can be treated from this thing by putting a button-like device by permanently closing. Sometimes there can be complex heart disease. So there can be abnormal connections in the vessels, and there is complex big septal defects. So they cannot be tackled percutaneously, so that they will do open heart surgery. There are third type, congenital heart disease. Fourth type is arrhythmias. I told you now. So electrical system. Electrical system can 2 things. If electrical system doesn't work, it can slow the heart rate, especially in elderly more than 70 years. Suddenly they came with the giddiness and loss of consciousness. Heart rate will be 30. Then we will keep a pacemaker. So we will keep a wire here in the heart, and we will keep a battery here. So the battery will give electricity to the heart to function properly.
What charges the pacemaker?
What is it?
What charges the pacemaker in the heart?
Cost
After
you want?
installation.
Yeah. There is a battery is there. It will work for 10 years.
It is put inside the heart.
Yes, from here there is
a work for 10 years.
Yes, what we do,
What type of battery is that?
lithium battery. So
Lithium battery.
yes. What will you do? So we'll keep a wire here, and we'll screw it to the heart. It will continuously take ECG, and what is happening, it will watch the heart. Whenever the heart rate is low.
It is charged by the blood current.
No. It is the charge. It will work for 10 years minimum. So it's a small battery, and we'll keep just beneath the skin.
Yes.
So it is small battery, and after 10 years, we can change the battery.
Oh my goodness.
So that is pacemaker. Sometimes the heart short circuit. Short circuit means suddenly heart beats with 200, 250 heart rate. So if heart beats like this 70 times per minute, there is a time to contract and relax. If it beats with 200, it will beat like this. So there will be no time to get the blood from the lung and no time to pump. So that brain will not get blood supply and patient will collapse. Then you have to do CPR. CPR. So if it is available, you have to give one shock with the AED or defibrillator mission. Okay. Then if it happens once the patient recovers, we will keep a shock giving mission in the heart.
Okay.
That is called ICD,
ICD.
intracardiac defibrillator. So we will keep ICD permanently, so that wherever the patient goes and falls, it will reset the heart, give the shock and reset the heart, and prevent the patient from dying.
Oh my goodness.
So these are all these things. Yeah, exciting. We will do interventions for stroke. So suddenly if the patient gets brain clot, we will go and do balloon angioplasty to the brain and remove the clot. So
Even
that
from the brain.
yeah, these are called neuro interventions. And if the patient gets, so we can do renal angioplasty, any blocks, anywhere, peripheral angioplasty. So there are gangrene. So cardiovascular disease means heart disease, brain disease, as well as peripheral arteries. So like if you got any clot in the artery and cessation of the blood supply here, we will go immediately and do angioplasty and remove that clot, and so that blood store can be restored. As in coronary arteries, we can do in any artery.
Yes.
So that is an advantage and technology. So nowadays we are using in cardiology.
You can hear from the doctor, can tell you can be treated here at Kids Hospital.
Yeah.
Please keep us following us on our Facebook page and our Shabi web page. Doctor will continue. What food do you recommend us to take?
Yeah, this is a very, very
For
important
healthy
question.
heart.
Yeah. So for healthy heart, you have to take less food. That's the most important principle.
Less food.
Less food. So you have to control your food. So
Limit
less.
food intake.
Limit your food intake.
Why do you advise us?
Yeah. You have to limit your food intake, and you have to limit your fats especially.
Yeah.
So less red meat. Okay, less red meat. And you have to take more fresh vegetables, salads, sprouts, nuts. Okay, so all
it's like peanuts,
almonds,
almonds,
and walnuts. So they are very, very important.
Walnuts are good.
Yeah, and extra virgin olive oil is the best oil, and you have to keep rotating your
we have
oils.
also corn oil. Is it good for health?
Yeah,
corn
what?
oil.
Corn is also good. Corn oil, rice bran oil, and
So
sunflower oil.
about,
Sunflower oil is also good.
vegetable oil.
Yeah. You have to take polyunsaturated PUFA, polyunsaturated fatty acids.
Yes.
So if you keep this frying the oil, so it will become saturated. It will become monounsaturated, and sometimes it will become trans fatty acids. So it will be black and all. So if you do more, so you should not use the fried more and more fried items and fried oils.
Yes.
Okay, you should use at least 1 or 2 times and leave it off, throw it off. But in our homes, say they will do all the 1 to 2 days. They will do all the cooking in same oil.
Same oil.
So it will lead to trans fatty acids. So directly it will go and deposit and clog your arteries. It's very, very dangerous. So avoid deep fried items, stored items, and take fresh items, freshly cooked, and unprocessed, like most natural items. Like take fruits, nuts, vegetables, sprouts, and salads. Less salt, very, very important. Less oil, less salt.
Less salt.
Less salt is the most key to the.
Also, this doctor, I had someone telling me, this kind of fruits, the red ones, red grapes.
Yeah, okay. They will contain resveratrol.
Even people who say that wine is good
Wine,
for,
yeah.
is it
So,
true?
I recommend to control your alcohol intake or limit your alcohol intake if you are a chronic alcoholic. Okay, but I don't advise to start alcohol for heart health.
We stop completely.
Yes, big. So any amount of alcohol is bad for health.
Any
But-
alcohol is bad.
Bad for health. But for the heart, so there are some studies showing chronic low consumption of alcohol may be beneficial, but there is no evidence for that.
No evidence.
But few
Please,
people,
no evidence.
and
So don't
few,
rush to take alcohol.
and some people say that red wine contains resveratrol and antioxidants, which can be good for heart, but there is no evidence.
But which is the best fruit for the heart health?
Every fruit is good for heart.
Every fruit is good.
There is no specific fruit. So daily take 2 to 3 cups of the fruits. So less consumption of fruits is a risk factor for heart disease, especially in Indian subcontinent. So you have to take plenty of fruits, nuts, vegetables, sprouts, salads, green leafy vegetables,
Green leaf.
all fresh, unprocessed.
Unprocessed.
Leave processed foods and canned foods, red meat,
Yes.
and more salty foods. Okay?
Sure.
Yeah.
Another very important question. Doctor, do you know anything about heart cancer?
Heart
Cancer. Is
Mean-
there any heart cancer?
means I don't know what is
No,
heart
I'm
cancer.
asking. Do you have cancer for the heart? I've heard of colon cancer. I've had liver
Cancer. Cancer.
Yeah.
Okay.
Yeah,
So
cancer.
I understand it concern. So there is heart cancer.
There is.
So there are heart tumors are there, but they are very rare.
Very rare.
So they are rhabdomyomas and some. So there can be some cancer like mass may form in either atria or ventricles. So but they are very rare, and they can be cured.
They can be.
And like there is no chemotherapy or radiotherapy needed, so we can do surgery and remove that. Remove that.
Or even at late stage. First
Yeah. Actually, this cardiac cancer is very rarest of the rare. I have never seen, I think, 1 or 2 cases in my life, all my 15 years of the career.
Oh, you have been doing this in 15 years?
Yeah,
Right?
cardiology.
Oh, that is good.
Yeah,
Very
cardiology
good.
is fascinating because if you can see a cured patient who are very serious, by the day 2 he will be happily going home.
Yes.
So that will give you a lot of satisfaction because life saving is our motto.
Doctor, do we have drugs that affect our heart health?
Yeah, few drugs, especially cancer chemotherapy drugs, they will affect heart health. Like if you give drugs for breast cancer or colon cancer, some chemotherapy agents. So many agents are toxic to the heart. So they will decrease the pumping of the heart, can lead to heart failure.
Yes.
Okay. So I forgot to tell there is another important thing in heart is pumping failure. So that is called heart failure. So once you get a heart attack and you did not go to a doctor, it is more late or it's 24 to 48 hours late. So the blood supply is gone and the muscle is already died, which can lead to pumping deficiency. It is called heart failure. So heart failure is very dangerous. So if you can walk for 100 meters, so you'll get severe shortness of breath. And you have to use drugs for the lifelong. Sometimes you may need to undergo heart transplantation.
Yes.
So here we do regularly heart transplantation for
Here,
heart failure.
Diseases Hospital?
Yeah, and it is the biggest center in the Asia, and highest heart transplantations are done here.
Here, Kim's Hospital.
Kim's
here.
Hospital, Secunderabad.
Hyderabad.
Yeah,
Secunderabad.
Secunderabad.
Ah,
This is the apex
okay.
center in India for heart transplantations and lung transplantations, as you know.
Do we have artificial heart?
Yeah, we do have artificial heart. It is called HeartMate 2, HeartMate 3. Very costly. So you can keep your heart in the box. You can carry and charge.
You carry?
I have seen patients.
Carrying your heart?
Yeah, carry over. It's artificial. Yeah, there are 2 types. So HeartMate 3, which is very costly, can be fixed. Then few hearts which can be kept in the box, and it work as a pump, and you have to carry the box. And you have to charge every 12 hours. Otherwise your heart will be stopped.
Now, what about this issue of heart donation? How do you go about it?
Yeah. So if any patient is met with an accident, so brain is dead, brain declared, so you can transplant all the organs, including the heart. So if any patient suffering with heart failure, stage 4 heart failure, not able to actually maintain their blood pressure, cardiogenic shock. So if the patient needs a heart, so you can keep the heart from the brain dead person in less than 4 hours and do a surgery. 4 hours. We have to. So we will. So yesterday it was done in Andhra Pradesh. It's so near this neighboring state.
Yes.
So they have transported heart from the Vijayawada to Tirupati, which is around 500 kilometers. Special flight,
Yes.
green channel. So if anywhere brain dead patient is there, green channel will be there. Like means no traffic.
No traffic.
No traffic. So they will control all the traffic. They will stop
Because of this.
because of this special flight. So anywhere in India, so you'll get heart. If something Delhi or Mumbai, if you have heart, if we have patient here, so special flight, it will come here.
Special flight. So the traffic can be controlled.
Yes, and
Specifically for heart
exactly because a heart transplantation should be less than 4 hours. That's why special flight to Hyderabad, from Hyderabad airport to Kim's Green Channel. There is no traffic. Immediately we will get the heart in a suitcase and transplant to this patient.
And how sure are you it is going to be compatible to the body of the
We will
patient?
see all the, before that we'll see all the tests, because blood group and all we'll match, and we'll give
Only
him
if it fails, we don't match.
usually it won't. So the matching is done already. So if it is matches only, we'll keep. Otherwise, we won't keep. And the patient has to use immunosuppression for lifelong.
It must be very costly.
Not very costly.
Why?
Yeah, it's not very costly.
Tell
We
me.
are doing in 20-25 lakhs rupees, which is very cheap, I think.
Okay, but organ selling is not allowed.
Yeah, organ selling is not allowed.
So it is donated freely.
Yes, there is an act, National Organ Transplant, NATO. So there is an act is there. So the transplant, there is a program called Jivandan here. So the hearts or other organs will be allotted according to the waiting list. There is no bypassing the list or something. So everything is done according to the law.
According to the law.
Yeah.
Very strict.
Very strictly is green channel and everything is free. So the traffic police will, if you inform them, the police will make the green channel happen. So voluntarily.
For the first time I've heard about green channel.
Green channel means, that means from there to the airport to the KIMS, there is no traffic.
No traffic.
Yes, anywhere.
Done by the
Police.
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 My goodness.
Yeah,
This
so
is
we are doing
very
regularly.
advanced.
Yeah, very advanced.
Only at KIMS
Only at KIMS.
hospital.
Yes,
Very encouraging.
That's why I request all the Kenyan patients to come here and take our quality services from KIMS, especially in cardiac.
I have evidence. I have 2 patients you have treated here.
Yes.
Cardiac issues.
Yes.
And they're doing very well.
Yeah, recently, yesterday only I have.
Bosses.
Yeah, pulmonary thromboembolism. Yeah.
From Kenya.
Yeah.
And I'm so happy. About
This week only I have discharged one patient from Kenya.
Yesterday.
Yeah.
That is good. I'm so happy.
Yeah. She's a 55 years lady. She came with brain stroke first. She was treated here. After that, she came with heart stroke to me, and I have put a stent successfully. They went home happily.
Great.
And they have great regards to the KIMS.
I'm so happy.
Yeah, I'm also so happy.
I'm so happy. I'm so encouraged by what you're doing.
Yes.
We wish you even bring a branch in Kenya.
Yeah.
KIMS in
Then I will
Kenya.
come and work there.
Yeah, you can. I have
Great service.
I have 2 cases of children looking for financial support.
Yeah, we'll also.
They need to come.
Yeah, let them come, and we have some this crowdfunding, this thing also there. So there are some foundations are there to help them. So please bring them. Financial support also we will also see for those patients.
I wish to know the foundations.
Yeah, please. I'll let you know.
I'll appreciate it.
Yeah. There are 2 things. One is crowdfunding, Milap, like, so there is a website that will crowdfunding. So if you keep the problem in the website, somebody will give in small amounts, it will become a big. And some Dr. Cinema star, that is Mahesh Babu, and some Little Heart Children Foundation. So they will fund at least half of the cost of the surgery, and half should be bare. Like, okay. So if the patient is genuine, the cause is genuine. So definitely,
very cases
definitely,
are very genuine.
please bring them. If they are really poor, so we will help.
Yeah.
From KIMS as well as from other sources, we will fund.
I will appreciate it.
Yes, sure.
I have to give you the even I have the videos.
Yeah, please send
I'll
me.
share to you.
Please share me.
Yes.
So that whatever the help from my side, I'm ready to
I
do.
will really appreciate it.
Me and from KIMS also.
I know. I
Yeah.
have no doubt it keeps hospital.
Yeah.
And I want the best for my people.
Sure.
Back in Kenya.
You are doing a good service to your
Thank you.
people.
Thank you so much, Doctor. And
Thank you.
welcome you to our country, Kenya.
Sure. Definitely one day I will come and meet you in your country.
Yes. You're
Thank
so
you.
much welcome.
Thanks for
Welcome,
your.
Doctor.
Thank you.
We appreciate it.
Right.